Heart anatomy. The heart is one of the most important organs in the body, located within the chest cavity. Its shape resembles a pyramid that has fallen over and is resting on one of its sides. The heart has 5 surfaces. The anterior or sternocostal surface oriented anteriorly. The diaphragmatic or inferior surface on which the pyramid rests. The right pulmonary surface, the left pulmonary surface, and the base, which is also called posterior surface. The base of the heart is quadrilateral and directed posteriorly. It consists of the left atrium, a small portion of the right atrium, and the proximal parts of the great veins, superior and inferior vena cava, and the pulmonary veins, which include the left superior pulmonary vein, the left inferior pulmonary vein, and the right superior and inferior pulmonary veins. The pulmonary veins entering the right and left sides of the right atrium and the superior and inferior vena cava at the upper and lower ends of the right atrium. From the base, the heart projects forward, downward, and to the left, ending in the apex. The apex of the heart is formed by the inferolateral part of the left ventricle and is positioned deep to the left fifth intercostal space, 8 to 9 cm from the mid-sternal line. This is the anterior surface of the heart, which faces anteriorly and consists mostly of the right ventricle with some portion of the right atrium and left ventricle. This is the diaphragmatic surface of the heart. The heart in the anatomical position rests on the diaphragmatic surface, which consists of the left ventricle and a small portion of the right ventricle, separated by the posterior interventricular groove. This surface faces inferiorly, rests on the diaphragm, is separated from the base of the heart by the coronary sinus, and extends from the base to the apex of the heart. This is the left pulmonary surface, which faces to the left lung, is broad and convex, and consists of the left ventricle and a portion of the left atrium. The right pulmonary surface faces the right lung, is broad and convex, and consists of the right atrium. The heart has 4 margins or borders: the right margin, the left margin, the inferior margin, and the obtuse margin. This is the right margin and this is the left margin. They are the same as the right and left pulmonary surfaces of the heart. The inferior margin is defined as the sharp edge between the anterior and diaphragmatic surfaces of the heart. It is formed mostly by the right ventricle and a small portion of the left ventricle near the apex. The obtuse margin separates the anterior and left pulmonary surfaces. It is round and extends from the left auricle to the cardiac apex, and is formed mostly by the left ventricle and superiorly by a small portion of the left auricle. The heart has 3 sulci: the coronary or atrioventricular sulcus, the anterior interventricular sulcus, and the posterior interventricular sulcus. This is the coronary sulcus that circles the heart, separating the atria from the ventricles. It contains the right coronary artery at the anterior part, and at the posterior part, it contains the small cardiac vein, the coronary sinus, in the circumflex branch of the left coronary artery. This is the anterior interventricular sulcus. The anterior interventricular sulcus is on the anterior surface of the heart and contains the anterior interventricular artery and the great cardiac vein. This is the posterior interventricular sulcus. The posterior interventricular sulcus is on the diaphragmatic surface of the heart and contains the posterior interventricular artery and the middle cardiac vein. So, as we wrap up our exploration of the heart surface anatomy and its sulci, we are just getting started. In the next video, we will dive even deeper into the heart's internal structures and functions. Stay tuned and don't forget to subscribe so you don't miss the rest of this comprehensive journey through heart anatomy. Thank you for watching DMZ Medical Lectures. If you found this information valuable, please give us a thumbs up, subscribe, and share with others who may benefit. Remember, knowledge is the key to good health. See you in the next video.